hygiene. Hey, hi Ivy, I'm your student nurse today. I'm going to be checking your glucose levels. Can you state your name, date of birth for me, please?
Yes, Ivy Armstrong, 3/9/1964.
Okay, I checked that on your R-band to make sure that's correct, and it is. Do you have any allergies?
No,
Okay. Do you have a preferred side on your finger? Which finger I should do?
the right index finger.
Okay. I'm going to scan the barcode and then scan the barcode for the patient to make sure everything is correct. And it is. I am going to check the strips to make sure the expiration date is good, and it is. I'm going to also scan it. Okay, I'm going to take the strip out. Okay, I am going to check the site to make sure there is no redness, irritation, or edema, and it looks good. I am going to clean the area for 30 seconds. Okay, I'm gonna let the alcohol dry. I'm gonna grab my lancet. Okay, it's gonna be a little pinch.
Okay.
I'm going to pinch the area on the top of the finger. Release. Okay. I'm going to wipe the first layer of blood so it doesn't get contaminated. And then I'm going to check blood with the scanner. And while that is loading, I'm going to hold the blood, the area, put pressure on it for 10 seconds. And the reading is 146, which is a little high, so I'm going to document the findings and then call a provider. And there is no more blood, so I don't need to put any tape or band-aids on it. I am going to fix that. Throw my items away, put this in the sharps container. And then perform hand hygiene. Is there anything else that you need before I go, Ivy?
No, thank you.
So now I'm going to perform hand hygiene. Okay, I'm in the med room. I'm going to check the MAR to see if I have the right patient. And I'm going to check the order. So the order says that I need to give NPH of 17 units, regular 7 units of insulin subcutaneous now. On the finger for blood sugar level because it's uncontrolled. Okay, so I'm gonna grab my items. Okay. I'm going to check the vials to make sure that the dose is correct. I have my NPH and regular insulin. The dosage is correct. Expiration date is correct. I am going to sanitize both of them for 10 seconds with different wipes. So the first one's going to be the regular insulin for 10 seconds. And then the NPH. Okay, then I'm going to roll the NPH so there are no bubbles. Okay, and then I'm going to open the needle carefully and touch the top so I don't contaminate anything. I'm going to uncap. I'm going to draw up 17 units of air. I'm going going to insert it in the NPH. Then I'm going to draw up 7 units of regular insulin. And insert it in the insulin. I'm going to draw up 7 units of regular insulin slowly. Okay. And then I'm going to draw up 17 units of NPH slowly so I can equivalent to 24. Okay. And then I'm going to tap it so the bubbles can go away. And then I'm going to use the scoop method to recap and verify with another nurse to make sure the dosage is correct.
Yes, correct.
Okay. And then I'm going to check the MAR for the second time to make sure I have the right patient. And I'm going to leave the room to perform hand hygiene. And then I'm going to enter the patient's room. Okay. Knock, knock. Hi, Ivy. I'm your student nurse today. I'm going to be administering your insulin. Can you verify your name and date of birth for me?
Yes, is Ivy Armstrong, 3/9/1964.
Okay. I verified that on your armband. Do you have any allergies?
No.
Okay. Do you have a preferred site? I'm going to inject the insulin subcutaneously in your abdomen. Do you want it to be on your right or left side?
The left side, please.
Okay. So I'm going to, can I lift your gown up?
Yes.
Okay, I'm going to inspect the site to make sure there's no redness, edema, or inflammation, and there isn't. I am going to wipe the site with alcohol for 30 seconds. Okay, I'm gonna let the alcohol dry. I'm going to get the insulin. I'm going to uncap it. I'm going to pinch the site. It's gonna be a little prick. Okay, I'm going to inject the insulin. Wait 5 seconds. 3, 2, 1. I'm gonna inject the safety cap, release, and take that out. I'm gonna hold that cotton ball on here for 10 seconds to relieve, to put pressure on it. And if it was still bleeding, I would put a band-aid or tape around it. But that looks good. I'm going to put your gown down now, Ivy. Okay. I'm gonna put the needle in the sharps container. Okay. Do you need anything before I go, Ivy? Your collar is right next to you.
Okay. No, nothing.
Okay. I'm going to document the findings, and then we'll look good.
All right, thank you.
I'm gonna do hand hygiene one last time.
And scene.